Thanks very much indeed, Cathaoirleach, and thank you for selecting my commencement debate today. As the Minister will be aware, Limerick University Hospital is in the news every day of the week, and I suppose for an awful lot of negative reasons. And I'd like to pay tribute to the staff who work really, really hard in trying to make conditions perfect for the people who attend A&E. But I know recently I wrote myself to the Minister, Minister Harris, and asked him to bring in somebody independent to overview the hospital, see what areas are working properly and how he's going to resolve the issues in relation to accident and emergency, because that really is where the kernel is, that's where the problem is. And I suppose my request really is for the Minister maybe to outline the process that's going to take place in relation to how to resolve the issues, and also what is being proposed in terms of resolving the issues in A&E in University Hospital Limerick as soon as possible. Thank you.
Can I first of all thank Senator Maria Byrne for raising this very, very important issue in relation to the hospital in Limerick, and can I also welcome the opportunity to address the House on behalf of my colleague Minister Simon Harris, the Minister for Health. The Minister for Health and I totally acknowledge the distress overcrowded emergency departments cause to patients, their families and frontline staff working in very challenging conditions in the hospitals throughout the country. The number of patients attending emergency departments continues to increase year on year on. For the first quarter of 2019, a number of patients attending hospital EDs increased by 7.6% and the number of ED admissions increased by 4.7% compared to the same period last year. The University Hospital in Limerick is one of the busiest in the country, and as such the hospital and CHO Midwest were identified as one of the 9 focus sites requiring additional investment, focus and support this winter. The problem of overcrowding in hospitals requires a full system, patient-focused response. Recognising this, in the Winter Plan 2018-19, the HSE sought to maximise the use of existing resources across the hospital groups and CHOs to target additional investment at both hospital and community service supports. The approach adopted by the HSE over the winter period for 2018 and 2019 within the financial and capacity parameters and have taken into account the increased demand, supported an improvement in patient experience and a reduction in the number of patients waiting on trolleys. The Health Service Capacity Review published last year highlighted the need for investment in additional capacity. Progress is being made on increasing capacity in UHL. The average number of open inpatient beds has increased by 4% between 2017 and March 2019. Since 2017, an additional 25 beds have opened in the UHL, including 8 as part of this year's Winter's Plan. A capital budget of £19.5 million has been approved for the provision of a modular 60-bed inpatient ward block at UHL, with the funding of £10 million allocated in 2019. Enabling works commenced in March this year, and the HSE advises me that the main works are expected to start in the second quarter of 2019. In addition, the National Development Plan includes a 96-bedded replacement ward block in UHL, and the capital funding was provided in 2018 to progress the design phase of the project. Planning for winter 2019 and 2020 has already commenced. The HSE is currently undertaking a review of performance across all hospital groups and CHOs over the winter period to inform planning for next winter. This review will enable an assessment by the HSE of the overall performance from a planning, implementation and outcomes perspective, a year on and against targets. In addition, it will encompass a review of the relative performance of the hospital group and the CHOs in comparison to other sites. The HSE advised me that this process will include an independent expert review of clinical, analytical and management capability in UHL and CHO Midwest, as well as the 8 other focus sites and CHOs. Thank you, Carla.
brief supplementary. Senator Byrne.
Thanks very much indeed, Minister. And while I welcome the fact that the modular beds and the enabling works have started and they're coming, and also the 98 beds that will follow, I suppose there's no short-term solution being offered here. We still have people on trolleys, and it's not just in the winter time, it's all year round at University Hospital Limerick. And really, I suppose what I'm trying to come at is there needs to be a short-term solution as to how we're going to resolve the overcrowding and the conditions that people are going through, both the staff and the people who attend the hospital. Because, I mean, while the solution you're giving me here is pretty much a long-term view, and you know, it'll be another 12, 18 months before we'll see these modular beds built. We need something in the short term to try and help, I suppose, the plight of both the staff and the attendees at University Hospital Limerick, and especially in the case of A&E.
Okay.
Finally, Cara Kelly, just again thanks Senator Maria Byrne for raising this very important. And of course I accept your point about short-term solutions in the immediate, and that's something, that process, and we need to resolve those issues. So I'll bring that message strongly back to Minister Simon Harris. But it's also widely accepted that part of the solution for Limerick Hospital is additional beds. We all accept that. And over the past 2 winter periods, an additional 25 beds have opened in Limerick, and 8, including 8 as part of the winter plan for 2019. But the bottom line here is that we need to move as quickly as possible, and we need to look at the whole issue of staffing, productivity improvements on their own, but also additional capacity must be delivered in tandem if we're to stand any realistic chance of meeting the healthcare needs over the coming decades, and particularly on the needs of the people of Limerick. Thank you.
Minister, and thank